The last question I have today is from Vic Motune, who is from The Voice. Vic.
Secretary of State, many thanks. I'd like to ask two questions, if I may. The first I'd like to address to Mr. Powis, and then the second to yourself. Mr. Powis, in your answer earlier, confirming the fact that there will be a formal inquiry into the fact that COVID-19 seems to be having such a disproportionate effect from people from Black and minority ethnic communities, you mentioned that there would be a number of experts who will be involved in that inquiry. Could you tell us or give us any indication of who those experts might be, if there's a timeline for the inquiry, or what the scope will be? The second question I'd like to address to you, Secretary of State. There appear to be some concerns expressed over the last few weeks about the fact that the hostile immigration policy that was such a big part of the Windrush scandal is curbing the government's ability to spread the government's ability to really stop the spread of the pandemic. We've seen in the last few weeks that there have been a number of really tragic cases of undocumented migrants who have developed coronavirus symptoms, have passed those symptoms on to members of their families, and in many cases have been too afraid to seek medical help, either because they may be deported, they may lose a job, they may even have their families evicted from wherever they're living. One of the real kind of concerns about this has been expressed by a number of MPs. I'm sure you may know that there has been a group of cross-party MPs who have written to the government, urging the government to drop NHS immigration checks and also drop charging of migrants for healthcare. So I wanted to ask, will the government heed that call?
Very good, thank you. Well, first, as I said in answer to an earlier question, we're very concerned about the apparently disproportionate impact of the virus upon BAME communities and certain ethnic minorities. And it's right that the review that's been commissioned by the Chief Medical Officer happens as swiftly as possible. Clearly, it needs to take the best possible advice and gather the right data so that it comes to the most accurate conclusions to inform how we continue to treat people and to manage the virus in the months ahead, because the virus in one form or another will be with us for a long time until there's a vaccine at least. And I'll allow Steve to say some more if he has it on how that review will be done. We're acutely aware of the anxiety within certain communities. As Community Secretary, that's extremely important to me, and that's why we're trying to reach out to all communities across the country to hear their concerns as we formulate particular policies. For example, faith groups, as we consider some of the arrangements that I described earlier in my opening remarks about how we treat people's funerals and the way that families can mourn for individuals that they've lost. I have heard a number of representations about those people who do not currently have recourse to public funds, who've come in an undocumented way from other countries. The government's policy on that hasn't changed, but there is the ability for local councils to make sensible decisions based on the risk to life that there may be in a small number of cases. And that's, for example, the way that I know many councils regularly treat real concerns, for example, with rough sleepers in winter, and it's the way that those councils would approach this situation as well. As regards to the broader question about the NHS and the very large number of people who come from all over the world to work within it and to contribute, well, I think an emergency like this does remind us again of the incredibly important contribution that they make to the NHS, to social care, and to our broader society. That's why steps like the NHS visa, for example, are very important, so that we can help people who want to come to the UK, who want to work in those services, to come here, to play their part, and to feel honoured and appreciated by our society for the contribution that they're making. Steve.
Yes, so as I said earlier, and as you've just heard, the Chief Medical Officer has commissioned this review from Public Health England. Public Health England do have experts within that organisation who are in this area, but I'm sure the Chief Medical Officer will also want to ensure that other expertise is drawn in from other academic groups or other areas that have expertise too. I can't give you the names, I'm afraid, but I do know that the Chief Medical Officer is working on that with the Medical Director of Public Health England, Professor Yvonne Doyle, who was on this podium yesterday. And I do know that he wants this to be done as quickly as possible, but also to be done rigorously to ensure that it is done appropriately, the right answers, the right conclusions are drawn, and it's the correct experts and the right experts who are able to look at this.
Very good. Thank you. Thank you very much for your question. Well, that concludes this evening's press conference. Thank you very much indeed for listening.